Who are you?
I'm Courtney Van Houtven.
And in which city and country are you based?
I'm in Durham, North Carolina in the U.S., and I work for the Durham Veterans Administration and Duke University Medical Center.
Great. How would you explain what you do to a layperson?
Okay, so generally I study economic evaluations and the economics of aging. What that means to a layperson would be trying to look particularly at how long-term care policies affect individuals' access to care and their health. I'm really interested in informal caregiving, how being an informal caregiver affects a person's health and their own prospects for work and their own long-term care needs in the future.
Okay. And what does long-term care mean to you?
Yeah, so I guess long-term care is any support that a person can get even in their home or in a nursing home, institutional based, that helps provide help with their activities of daily life. So this could be as simple as getting groceries for them or helping them walk to the restroom versus up to nursing care and really intensive care for people who are severely disabled.
Okay. And what would you say it doesn't include?
Doesn't it include? Well, in the U.S. it doesn't include a lot of things, but it doesn't include, in terms of what we reimburse for, it doesn't include things like cleaning your house and things that the social welfare states of England and the other countries in Europe cover.
Okay, okay, interesting. What would you say are some of the main policy priorities at present for long-term care in the U.S.?
Yeah, so I guess just financing the upcoming tide of elderly. There's going to be a huge number of people with Alzheimer's and other disabilities. So trying to figure out a way to finance it. The fact that individuals don't really purchase long-term care insurance in the U.S. for sure, and that they kind of don't plan for what they're going to do until they're in a crisis. This creates a lot of issues.
Okay, okay. And do you think that the priorities have changed over the last 5 to 10 years?
I think they have. I mean, I think that in the last 10 years it's been this concern about the expansion of the public expenditures on long-term care, both Medicare and Medicaid. And that's certainly still a concern, but then there was a big move and hopeful step in trying to think that in our healthcare reforms, the long-term care was going to be covered. So there was a big move towards getting that as a means of expanding people's ability to finance their own long-term care and not rely on Medicaid, which is the public insurer for long-term care in the U.S.
Okay. What's the sense you get? Is the current financial crisis having an impact on long-term care in your country?
Yeah, it definitely is in terms of people's ability to pay for private long-term care insurance, and maybe in the number of people who are in kind of a low-income state in their older age, but that they didn't expect. So a lot of pensions and investments of people kind of reaching retirement age took a big dip with the crisis, and that either kind of made them more vulnerable in their old age if they had a health shock, so they might not have saved as much as, or they might have let their long-term care insurance lapse, or they might have become eligible for Medicaid more quickly than they thought they would. So maybe less reliance on the private market and ability to pay for their own care, and more reliance on public insurance, or more hope that that would be something they could rely on.
Okay.
Also a lot of, with the younger generation being unemployed, or more people being unemployed or in their own financial straits among their children who often provide care for them. I think that's maybe created people being more available to become informal carers, but in a sort of state of less financial security for both generations.
Interesting, interesting. If you had the opportunity to introduce one new policy reform, what would it be and why?
Well, I think that I would have hoped that some form of the Class Act would have passed. And that's because I think it is going to be a huge problem in the future that we are underinsured for long-term care. And it can be pretty devastating. We've been doing qualitative research on families, how families deal with what they need, and you hear so many stories over and over again about how my parents didn't plan well enough, and now they're devastated and we're devastated, and we're also really stressed because we had to provide the care. So if people have a more manageable means of being able to finance and insure against needing to kind of rely on informal care only before you kind of deplete your assets and then need Medicaid, then I think it would be a huge benefit. Right now, only people who are fairly wealthy buy long-term care insurance, and that's really not a great model for helping people who are in middle incomes and hardworking people, but there's no way they'll be able to pay $300 a month in premiums since age 55 or 60 and keep that going.
Great. How likely is it that some form of the Class Act would be passed in the future?
Sound pessimistic, but not. Well, it depends. Depends. I think it's very unlikely, even if President Obama is reelected. But I think maybe. I never thought that the universal mandate would be upheld by the Supreme Court either. So I think I'd like to be surprised and say that it has a chance. But right now, I don't feel like it's a very, very good chance.
Fair enough. So Courtney, in your view, what is the most important piece of research evidence that we need to do to inform policy changes in the U.S.?
So I think that this is very selfishly in my own area of interest, but I think that we need better evidence on kind of how does the reliance on informal caregivers and the reliance on formal providers of care, how does that really affect net societal costs? So people often say, well, it's so great, why would we compensate informal carers because they're providing it anyway, we don't want to compensate them even if they're going to be providing it, but without, and also they save long-term care costs and they're doing it of their own free will, but without looking at sort of the savings that you get from informal caregiving in terms of saving long-term care dollars and delaying entry into nursing homes, you also have sort of some potential negatives that need to be included in that to understand really the net cost of it. So people have to quit their jobs early or they retire early as an informal carer, then it's not just affecting, it doesn't matter that you're saving long-term care dollars, but you're also then creating insecurity in your own old age because you haven't earned as much as you should have or you don't get the full Social Security benefit, for example. And there may be health effects that you don't anticipate that affect your own healthcare utilization and costs.
Okay.
So I think understanding sort of the full picture of it's not just that we're saving long-term care dollars, that we have other problems affiliated with relying on this kind of informal system in the U.S. that we could really evaluate whether we need to change and provide substantial support for informal caregivers or not.
Okay. I have a few quick-fire questions. Could you rate these particular questions between 1 and 10, 1 being low, 10 being high? What policy priority is allocated to long-term care in your country?
3.
Okay. How aware is the general public about the long-term care system and what it offers to people in need of care?
2.
Okay. And how well does the system support people with long-term care needs?
3.
And how well do you think it supports their carers?
2.
Okay, great. Thanks very much.
Pessimistic.
No, it's fine. Thank you very much.